She preventing wounds. And
Alexandra Greenhill is on the forefront of e-medical technology. At this year's BC Tech Summit, the medical doctor turned entrepreneur was a keynote speaker in demand.
Are you a doctor? Are you an app developer? Are you an entrepreneur?
Labels don't matter. I'm a change maker.
She still practices medicine, but she's also an innovator. It was a personal experience with an aunt who had dementia that inspired her work.
Because I was a physician, I knew what was the best thing that should be happening in her care and could stay on top of it. But I watched other families go through this and not know what they didn't know.
That led to the development of an app called Careteam.
Currently, a patient gets diagnosed by one organization, gets handed off to another one. There's multiple cooks in the kitchen, so to speak, and everyone's giving them confusing instructions. And so Careteam is a collaboration platform for the modern healthcare team. And so it takes all of the healthcare providers, but also the family and whoever else the patient uses as support, and helps them get on the same page and understand what is the plan, who's doing what, and what is the possible best way of achieving the best outcome.
Do you think, though, there is a reluctance on the part of governments or hospitals to use something like this?
The big reluctance with technology has been that we've lived for 2 decades of people over-promising and under-delivering, of blaming the end user and saying, well, if this app is not getting used, it's because patients are resistant, or if this system didn't help the hospital, it's because doctors don't like technology. Doctors and patients love technology. Just look at the adoption of iPhones and Fitbits. They just expect technology that works well, that understands them as humans.
Careteam and Baycrest Hospital, based in Toronto, recently joined forces. The facility focuses on research in brain health and aging.
Were there any concerns about privacy?
Of course. And so privacy is paramount, but a lot of people don't understand that without security there is no privacy. So you need to make sure that you're secure, first of all, and meet all the requirements. But I would even say exceed the requirements. And then the other important thing is you need to give the power to the patient to decide who within their family circle needs to see the most important private results. And so Careteam is built with a role-based access where the patient is in charge.
This isn't Greenhill's first foray into technology. She also developed an app called My Helper for the sandwich generation, those who are trying to juggle children and aging parents. It's in Greenhill's DNA to help.
People are afraid to ask for help, though, aren't they?
We equate strength with independence. We equate asking for help with weakness, and the idea that I'm going to interrupt someone, it's going to disturb them, then I have to owe them, I don't know how to thank them. Will they do it the way that I want it done? And when you open yourself to the reality, and this is where dramatic events make it realize that it's not so bad. And so most people who have firsthand experienced this wait until they're at the end of the rope, and then they say, Mayday, I need help. And then they discover that people don't mind giving them a hand. They don't mind stepping in and helping.
So what's next for you?
I'd love to see Careteam used in every hospital across the country so that they can optimize how patients experience life with a chronic illness.